is convalescent. You know what convalescent means, right? You're on the mend, you're healing. It's not the whoop goes away, fever goes away. You're gonna still have some coughing, runny nose, maybe some of those upper respiratory type symptoms, but it's not severe. You're getting better. You're on the up and up. They're eating, they're drinking. But that cough can last, and it can last for up to 10 weeks, like I said earlier. This again is not really one of those fancy ones that you can really differentiate it from your other stuff regarding physical exam. It's kind of like what we said on RSV. They could, if you listen to their lungs, they could have some wheezing. Their O2 saturation might be affected. They could have a runny nose, coughing in the room. They could be tachypnic. Their heart rate may be up, but it's not real big telltale signs to differentiate. It's going to be your history, or if you physically see them do it. Not a lot of fever in this one. They can have it though, but it's not one of your like 104.5s. Bullet point 4 is interesting and very true. They cough so intensely that they will bust little blood vessels in their face and in their eyes. So they'll have like little blood petechiae in their skin and in their eyeballs. Conjunctival hemorrhages and facial petechiae. And that's just from the valsalva, or the pressure that builds up in their head from coughing. You can do, there is a test for pertussis, yes. There's a freaking lab test probably for anything known to man. But a lot of times it's delayed. If you really think this person has pertussis, you gotta start treatment that day. You don't wait and say, I'm gonna send this off to the state board, because it actually goes to the State Board of Health. They have a blood test for pertussis and a swab, but that's not what I would test you over. But you're not going to wait on that. You've gotta treat it, it's like tick fever. You'll learn this. If you think someone has tick fever, do you think you wait till you get those titers back 3 or 4 days, a week later? No, you treat them right then and there. Because the disease, the issues of pertussis are far more detrimental than you giving them an antibiotic and they're not having it. Does that make sense? So if you have a good clinical presentation, you have a good idea this is what is going on, you just treat them. Which is basically what this says here. There's actually diagnostic criteria that you can actually use if you don't do a test right then and there, and it says it right there. I don't expect you to memorize that. That's just for you. You need to know this. And this will be great when you go out on your PEDS rotations and when you go out on your family medicine rotation. So acute coughing illness that lasts 14 days in a person at which one characteristic pertussis symptom is present. They're up there. The whooping, the blood vessel, petechiae, conjunctiva, post-tussive emesis. Or if they have a cough that's 14 days and they're in an area where you know other pertussis cases have been diagnosed. Or you have, obviously, a cultured or isolated, you have done the blood or the nasopharyngeal swab and it comes back. Yes, ma'am.
Is it possible for a child to get pertussis even if they are vaccinated?
It depends on what time period, if it's actually waned, but not so much, because you actually also get herd immunity from pertussis. Do you know what herd immunity is? Like when someone gets it, is anybody here did immunizations? Is there any?
Yeah.
Do you go ahead? Do you want to?
Oh, well, I don't know about herd immunity.
Oh, okay.
I
But like
like
sometimes when you get certain immunizations, being around other people that also have it, you all share kind of the same like stuff that's been antibodies. That's what herd immunity is also from. Would you have any great information on the?
I mean, we never saw pertussis, but we a lot of kids we immunize with DTaP.
Yes.
And I don't know if adults get DTaP, it's more the tetanus Tdap, right?
It's actually reversed. There's DTaP and there's Tdap.
Yeah,
that's what you get. You're absolutely right on that. One is what the little ones get when they're immunized, is go for well child checks. But at a certain age, what age is it that you get the Tdap?
Well, you get that for when you go into like 7th grade, like your 11-year-old shot.
Okay, I don't even know this, so that you can
Yeah.
do something more than I do on that. And then that is the one that you get when I was telling you get when you're pregnant, the Tdap with every pregnancy. Again, kind of like your RSV, nothing really great there in regard to your chest x-ray, unfortunately. You can have some infiltrates, edema, you can have some atelectasis, and again, that's just wherever that great bunch has collapsed on itself because of inflammation and fluid mucus production. Obviously, consolidation or a focal area would be indicative of a secondary bacterial infection, i.e. pneumonia. Sorry, that's kind of boring. Oops. You do have to provide them with supportive, obviously, but there is an antibiotic for this one. You can actually give them an antibiotic. But obviously, mainstay therapy is support. That's, yes, because you've got to make sure they aren't coughing their head off. You've got to make sure that their oxygen's okay. You've got to make sure that their fluid balance is good. They're getting fluids in, they're not dehydrated. That's what mainstay, that's what supportive therapy means. So bullet point 4, that's important. I was going to look this up.
Do you know if Dr. Witowski's going to teach it that way as well?
I don't think she actually does pertussis because it's not one, what do you mean? I'm sorry, I didn't know what you were going to ask me. I was just jumping out there.
I was talking about the macrolide antibiotic,
Like, is she just going to say macrolides?
or no antibiotics.
Is she going to make you no antibiotics?
Like, would
She
we use a macrolide, or
say-
would we not use an antibiotic at all?
You would, say that again. I'm sorry, I misunderstood what you're asking.
Would Dr. Latasi suggest an antibiotic as well for pertussis?
Yes,
Okay.
yes. You have to treat pertussis.
Okay.
Yes, yeah. I'm sorry, I thought you were like asking me like, that's exactly right. I'm trying to pull this up real quick here. Azithromycin is the go-to. I was about to write out the dosings and all that, but I won't bore you with that. Azithromycin is the drug, macrolide. Do you know macrolides? I bet half the people in this room have taken azithromycin, Z-Pack. They give them out like candy at urgent care. So it's azithromycin, which is a macrolide. Dr. McNeil does your he's going to give you a little antibiotic introduction to ease you into it. He will tell you what a macrolide is, so I won't bore you with it. You can give this up until any age. There's not like an age cutoff, like you're too young to take a macrolide. So azithromycin's your go-to. We'll look at something here. The way Hippocrates breaks it down, which if you ever get one stinking app, do not go buy tons of apps. The best app is Hippocrates. It is amazing. I use it every day in practice. They even break it down to infants less than 1 month of age. This is for treatments. Infants and children 1 month of age, greater than 1 month of age, non-pregnant adults, and pregnant adults. Azithromycin still it for greater than 1 month of age. Azithromycin, clarithromycin, or erythromycin. It's ACE.
What's the app called again?
That's how I memorized macrolides. Sorry, I'll tell you. Azithromycin, clarithromycin, erythromycin. Azithromycin's number 1. But maybe you can't get azithromycin in your area. I don't know why you would go to the clarithrol or erythro. There's reasons. But if they're allergic to azithromycin, you probably want to get out of that class, right? So what do you give them if they can't do macrolide? It's Bactrim. And you can, I know you guys can. Hippocrates. I love it. I love it, I love it, I love it. At OU, let me check on this and I gotta hurry. At OU, there was a way that you could actually get it free if you were a student. And I'm talking, there's a little.
It's free.
It's not. That little simple version, but if you want like how to work somebody up, give them what medications, it's like $145. I wouldn't say get it now. I'm saying when you're out practicing, that's what I'm sorry, that's what I mean. There is a free version, there is. But the big boy is amazing, I love it. I use it mainly, what helps me is medications. Like, I'm like, crap, I don't know how to treat pertussis, what do? Oh, yeah, here it is. I just,
Do you like it better than up to date?
okay, here's my up-to-date thing. Yeah, I'm not a big up-to-date fan. I think up-to-date is, don't get me wrong, it is amazing, but if you want something down and dirty, you're in clinic and you have 6 people waiting on you, you wanna look something up, Hippocrates is the way to go. Has anybody ever been on up-to-date? It is a lot of information. I mean, it's like, it's a lot. If you're gonna write a paper or you really wanna study something, I think up-to-date is really good. But if you wanna be in clinic for a good clinical tool, I think Hippocrates is better. But up-to-date's good, I'm not knocking it, I just always get real like, I just wanna know what labs do I,
Yes.
and that's what Hippocrates does, it does for you. So macrolides, first one, that's what you're gonna give azithromycin. If they can't do a macrolide, they're allergic to it, you're gonna go Bactrim. I'm just looking to make sure, non-pregnant adults, it's azithromycin still. It's also a macrolide with pregnant adults. So pertussis, this is easy, right? Pertussis is macrolide, azithromycin. Any one of these macrolides with azithromycin first. That's easy, right? You can remember that. But if they had an allergy to macrolide, what would it be? Bactrim. And when you get your case vignette on your test, read it all. Because you may go, man, this person has pertussis. You go look in the answers and there's like azithromycin, Bactrim, penicillin, blah, blah, blah. But you didn't read what their allergy said, and you said it's azithromycin, but then it said in the bottom, allergy, macro, you would miss that one. Just read it. Always look at allergies. Allergies are huge for medicines.
Can we get the app for free?
I don't know how, I don't know, the big one, the,
No, it's not. Hippocrates Plus is the 174.
Yeah.
You can
That's
get the
the big
base
one.
it.
yeah, the free one anybody can get, I think. You just get on there and download it. But I'm saying at OU, the students can get the big boy, the 170 whatever. But I don't know, let me check on that. Let me check on it for you. There is vaccine, oh, there we, what was we talking about?
Yeah.
There you go. Read that on your own. Differential diagnoses, basically kind of any upper respiratory, adeno-respiratory, but adeno is, adenovirus, that's common cold, one of the millions of ones that can cause it. Mycoplasma pneumonia, it's type of pneumonia, chlamydia pneumonia, these are some of your atypical pneumonias. And that's because you get that conjunctival issues, the eye issues with chlamydia. And you also get a pretty intense cough with chlamydia, a pneumonia that is chlamydia-based. So you might think pertussis. RSV, yep, you could think that. Okay, so there's that. We have 30 minutes to get through cystic fibrosis and bronchiectasis, and I know we can do it. We can do it, guys. Any questions over that? Oh, yeah, go, yes.